Does osteoporosis cause pain? The simple answer is no, but the more complex answer is kind of. So let me explain. Osteoporosis is a disease. It's a disease that causes our bones to degrade faster than the creation of our bones. Our body normally has what's called homeostasis. And with homeostasis, the body is able to have this relatively perfect balance between the creation and degradation of what's made in our body. But in the case of osteoporosis, the creation of bone does not match up to the degradation of bone. As a result, we see things like this. Take a look at the top image. This is a bone with normal density or optimal density. And the image at the bottom is a bone that has osteoporosis. As you can see in this image, there are a bunch of holes, there are spaces, and there are gaps within our bones. The disease itself and the process itself of the degradation of bone is not painful. It's not like our nerves have open endings or this process stabs our nerves with the jagged edges of these holes. It's not like that. So osteoporosis itself does not cause pain. And that's why there are so many cases in which a person thinks they're fine. But once they go to their annual checkup and their doctor suggests that they get a bone density scan, that it's not until an image is taken or the result of your bone density scan tells you, boom, you have osteoporosis. You had no idea. And that is actually very, very common. Earlier, I did mention that pain can kind of be an indicator of osteoporosis, so let's expand on that. The most simple example to use would be that of our lower back. So think of your spine. We have bones and discs and bones and discs and bones and discs. This is a solid structure, a supportive structure. It literally holds you up. So in this picture, these are healthy bones. But if your bone starts to become a bit more brittle, thus it's not as strong as it once was, it's going to make other components of the body have to work a bit harder to physically keep us up. And when I say other components, I'm talking about things like your muscles. Ideally, we have a nice harmony between the supporting structures of our bones and discs along with the muscles. But if our bone starts to again degrade and become more brittle, such as with the case of osteoporosis, it's up to the muscles to be able to support the same structure, which is our body. When you have to overwork anything, in this case, the muscles, it can create excessive stresses. So think about things like a strain. So think of a muscle strain. So it is possible in this case that osteoporosis can indirectly cause pain. Now, another example of what can cause pain through osteoporosis is something called a compression fracture. So let's use the example of the spine again. Let's say that your spine, the bones of the spine are getting so brittle to where it cannot support the weight of your body anymore. It can result in a compression fracture. And a compression fracture looks exactly like what's in this image. The weight of your body, with the addition of gravity, crushes the bones together because that bone is not strong enough. Sometimes this is a very gradual process and a person doesn't even feel pain with this. The only reason this person might know that they even have a compression fracture is because they happened to get an x-ray for potentially something else. So it might be painless. For other people, it can occur very spontaneously. And when something quickly crushes, it's likely to result in some pain. A compression fracture is actually very common in those who have osteoporosis, so it is something to stay on the lookout for. One more point I want to make. Let's say you have osteoporosis. Does this mean that osteoporosis is your source of pain? The answer is no, not necessarily. Your back pain might be because you had a herniated disc from holding a heavy weight incorrectly or picking it up off the floor incorrectly. So just because you have osteoporosis does not necessarily mean that it is causing your pain or that you have to have pain because of the presence of osteoporosis. If you're a physical therapist or physical therapist assistant student studying for the NPTE, check out our courses at sptwithme.com. Check out this reference for more information.